If you've ever wondered how to use your out-of-network benefits to get reimbursed for seeing a psychiatrist or a therapist who is not in your insurance network, we are going to look at how to do that in this video. I'm Dr. Nishi Bhopal. I'm a psychiatrist and sleep doctor, the founder of Pacific Integrative Psychiatry. We're an online telehealth practice seeing patients across California for anxiety, depression, sleep issues, along with nutrition and gut health for mental health. So we're talking about how to use your out-of-network benefits to see a psychiatrist or a therapist who is not in your insurance network. Because we are an out-of-network practice, but many of our patients are able to submit what's known as a superbill to get reimbursed for a portion, sometimes a very large portion of their session fees. You might be surprised to learn that seeing a therapist or psychiatrist who is not in your insurance network might not be as out of reach financially as it feels at first when you first hear the fees. Sometimes people get a little bit of sticker shock when they hear the fee. However, I can tell you when I used to work in an insurance-based system, my patients would pay a copay to see me in that system. When I started my own practice that was out of network, many of those patients followed me over into my private practice. Those patients are then given a super bill that they submit to their insurance to get their session fees reimbursed. And some of my patients told me that they're paying about the same as they were for their copay when they were seeing me in the insurance system. Now they're paying a private fee and then they get reimbursed. And at the end of the day, it's actually not even that different. Now, of course, that's not going to be true for everybody, depending on your plan, the type of insurance that you have. It's going to be variable depending on all of those things. But I just want you to consider looking into it because it might not be as much or as out of reach as it seems at first. So here we are on our website. And so I want to show you a new feature that we've added to our website where you can actually get an estimate of your out-of-network benefits, or if you're a patient with us at Pacific Integrative Psychiatry, you can now file your super bill for reimbursement directly from our website. This is a nice feature and it just makes it a little bit easier for people. Here we are on the homepage and you'll see that there's this button that says use your insurance. We use a platform called reimbursify that makes it easy for people to check their benefits or to submit their super bills. So all you do is you click on this button and then you're going to see these two things pop up. There's a button that says verify your benefits and then this one that says file a claim. If you are not already a patient with us, or even if you are and you want to check what your out-of-network benefits might look like, you can get an estimate. You just click this button and you'll see this form pop up. So here's our practice. And all you do is you enter your details. So you fill out this form, you click verify benefits, and then it's going to give you an estimate of how much you're likely to get reimbursed depending on your insurance plan. Again, this is not an exact number. It is an estimate, but it's just a good way to get an idea of your coverage. The other thing you can do is that if you're a patient with us and you want to submit your super bill directly from the website, you can do that as well. Just click on this button and then you choose file a claim. So you click that and then you go ahead and select the person that you've been working with, your practitioner's name. I'm going to select myself here and then you click next and then you fill out the details and then you just follow the instructions and you can file your super bill directly from here. Okay, so at this point you might be wondering what exactly is a super bill? What the heck am I talking about? So if you're not familiar with a super bill, let me show you what that looks like. Let me show you what a super bill looks like. You'll see here, this is a sample super bill. This is not a real patient. There's no identifying information being shown here. At the top, you'll see your information, when you saw the doctor, your date of birth, some of your information, the doctor's name. Again, this is not a real doctor. This is just a sample. There's two types of codes that your insurance company will need. Those are the diagnosis codes and then this code, which is the type of appointment. So there's two sections. There's the CD code section and then the CPT code section. Then you'll see the charge. Then the insurance company knows how much you paid for the visit and then your reimbursement will be a percentage of that. This is an example of what a super bill will look like. Now, I also wanted to show you inside of Reimbursify what our patients are typically getting reimbursed for their sessions. Again, there's no patient identifying information here, but you can just get an idea of what people are getting reimbursed. So you'll see here there's different visit fees, and the visit fees depend on the practitioner that you're seeing or the type of appointment that you're having. If you're curious to learn more about the different types of appointments that we offer, you can call our office or send us an email and we can share more information. Here you can see this is what each patient, so these are all different patients, what they've paid. You can see the amount, their estimated reimbursement after they meet their deductible, and then the amount that they're expected to get reimbursed for the visit, and then what insurance they have. So let's just take a quick peek here. You can see for this particular patient, they have healthcare, they're estimated to get 70% of their session fee back. So if this was their session fee, then their reimbursement is going to be approximately $137.50 to $175. So this money is given directly back to the patient. For this patient here, they have Blue Shield of California. You can see this was the amount for the visit. This is how much they're estimated to get back, and this is the dollar amount of that. If I just scroll down, you'll see that most people are getting somewhere between 50 to 70%, depending on their plan. Most people have Blue Shield or United. There's Anthem. I know there's some people who have Cigna and a few other insurances. You can see some of those estimates here. So again, this is an estimate, but it gives you a nice idea of how much you might be able to get back. And you can see in many cases, it's around somewhere like 70%. So that's pretty good. And so, for a lot of people, the fees end up being a lot less than what they initially thought. You can also submit your superbill directly back to your insurance company. So you can do it through your insurance company's portal. If they have one, you don't have to use reimbursify, but this is just a really easy way for you to do it without having to go through all the hoops with your insurance. It's a nice platform to use. And then we can also help keep track of what's going on our end as well if you file this way, because we don't have visibility into the insurance portals. So I hope that was helpful. Hopefully that gave you a little bit more insight into what a superbill is all about, into what out-of-network benefits could look like, into what your reimbursements might look like. And again, you can go back to our website and you can click on this button if you want to run through your benefits and get an estimate of what that might be. We do see patients all across California. So if you're interested in learning more about what we do for a whole body approach to mental health, you can schedule a free call directly on our website. It's a 20-minute call with our assistant, and she can also look up your benefits for you and let you know what services we offer and if we'd be a good fit for your needs. I also hope that it helps encourage you to consider working with a therapist or psychiatrist out of network, because as I was saying, sometimes the fees are not as much as you might think they would be at first. And I don't want that to be a hindrance to people working with someone who is a good fit for them or who offers specialized services that you might not be able to find within your insurance. This is a nice way that you can actually get access to those services. If you have any questions, I'll put our website in the video description below this video, so you can go ahead and check that out. Feel free to contact us, and I hope this was helpful.